Matthew Holt. Thrilled that at rather late notice, I am sitting here with Bridget Duffy. Bridget is a long history in leading some of the greatest innovation in patient experience in healthcare. These days, is the Chief Medical Officer at Vocera, and I'll get this wrong, but the head of Vocera's Patient Innovation Network?
Experience Innovation Network, the EIN.
EIN, that's right, fantastic. And she does many things, including running your own events and conferences, and you have a network of hospitals all around the concept of patient experience. So, for those of us who don't know, remind us what Vocera does.
Absolutely. Vocera solves for what is the single most broken thing in healthcare, which is communication. So we try to create and rehumanize healthcare through improved communication. We want to create a consistent, seamless experience of care before people arrive into the doors of the clinic and after they leave a hospital or a clinic. It's just, when I was at the Cleveland Clinic as the Chief Experience Officer, that was the number one complaint per year. We had 11,000 complaints in 10 categories. The top bucket was communication. Never knew who my doctor was, wasn't listened to, wasn't treated with dignity, wasn't treated with respect. Don't you specialists talk to each other? Why do you ask me what the last guy said when they came into the room? Things like that. So we are a software play where we help connect doctors and nurses and data at critical moments on the patient's journey.
So Vocera started out with the little upheld communicators, which I think is still a big part of the business for nursing.
Right.
You come from the world of patient experience, and yeah, it kind of makes sense. On the other hand, it's a bit of a jump from what you did before. So how did you get involved with Vocera?
Well, actually, it's not a jump at all, because the only way to improve the patient experience is to improve the nurse and the doctor, the caregiver experience. And right now, the second crisis in healthcare besides broken communication is the burnout of doctors and nurses. It's epidemic. Over 50% of doctors and nurses are emotionally exhausted, and that's the number one contributor to adverse events or errors, and it's the number one reason patients are dissatisfied. Because when you have burnt out doctors, they depersonalize and dehumanize the encounter, they objectify the patient. They'll call them the pancreatitis in room 203 versus Mrs. Jones. So it's not a leap that I'm at Vocera, and what we do is we are the only hands-free technology in the world that allows a doctor or nurse in the ER, the OR, the NICU, the PICU to be able to be at the patient's bedside, but now we're device agnostic. We are software play where you can, in a HIPAA-secured way, text each other. I think the critical thing we do is we restore the voice and the narrative back to healthcare. We restore the patient's story, and we allow doctors and nurses to talk to each other versus being digital data entry clerks into the EMR. So instead of talking to each other, doctors are writing their notes down outside the OR instead of going up to the floor. We allow a doctor to find instantaneously the nurse assigned to their patient and say, hey, I just did this procedure, but I'm worried about this. Will you watch the patient through the night on X and call me if you need me? So we allow instant connection by role, so that what we do is we ease the burden of being a doctor or nurse, and we allow them to be back at the bedside. And when we do that, when we optimize efficiency and performance of doctors and nurses and ease the dysfunction of the bureaucracy and the broken technology, we actually improve their well-being, which then drives improved patient experience. So I am in my sweet spot at Vocera because my mission on earth is to humanize the healthcare experience, and that's what we do.
Great. So talk to me a little bit about the wider trend of people and organizations caring about experience as patients. We've in some ways, we've had lip service paid to patient centricity over the years and this and that, but it obviously hasn't been a great experience. I'm actually, you see the people with the walking gallery jackets around tonight, many are telling stories about how the system failed them.
I love that. That's Regina Holliday's
Regina Holliday's group, and even as recently as last year.
I've worn my jacket. I have one.
I have one too, which is actually somewhere in the next door room.
I wish I had mine.
She's in the water tonight. I'll hook you off after the interview.
I'm gonna get in trouble for not wearing it.
But anyway, even last year, our friend Jess Jacobs went through this awful experience where she ended up dying after many years of really, appalling customer service, really, from hospitals. You obviously been at the forefront of putting a group of hospitals together to address these issues. Where are we in this process? I mean, how much is the sort of it moving from lip service to real intent to change, and in what type of institutions and what percentage of institutions?
We are so far behind. We are still so broken in healthcare. Often patients equate the patient experience next to the DMV or the airline industry. We have got to go faster. My mentor is 94 years old. He invented the pacemaker, founded Medtronic, and he calls me every couple of weeks and says, Bridget, go faster. Healthcare is still so broken and fragmented. And the reason is we do not engage or embed patients as co-architects or designers on process improvement or technology decisions. We inflict these things on the patient and on doctors and nurses. So that's why I love Michael Sears and Medicine X, and what you're doing is you actually listen to the voice of the patient consumer and bring human-centered design into the trenches so that we can go faster. There's no reason we can't do hackathons with patients in a weekend and have a new operating room experience. So for example, because of one patient doing that with us, instead of informed consent right before we put you to sleep in the OR, telling you can get an infection, bleed, even die, please sign here, one patient said to us, how about informed hope? Why don't you tell me all the things I could live for and ask me those questions? So overnight, now we have informed hope as a standard operating procedure in an operating room experience. So instead of going to bed, sleep with fear they're not going to wake up, they can think about what they have to live for on the other end of that experience. So I think we're still far behind, and shame on us in healthcare that we waited till the government mandated we measure patient experience, publicly report it, and then they tied incentives to it. So that moved us to go a little bit faster, but I think there are enough enlightened organizations that are going faster, and we're part of that network. They came to me and said, Bridget, instead of us reacting to the government, why don't you convene a group of physicians and nurses to lead that for the nation? So we're going to cap the membership of Vocera's Experience Innovation Network at 50 members, and our mission is to set the pace for innovations that humanize the experience, accelerate adoption, and put research and data behind it. And Dr. Arnie Milstein at Stanford's Clinical Excellence Research Center is our research partner to do that.
You couldn't find a better one than that. So those of you who don't know, Arnie Milstein, one of the leading medical directors of the US for the last half century by a long way, I think. Talk to me a little about how we sort of bring if that's the leading edge, you've got 50 organizations who are committed to this. Obviously you were at Cleveland Clinic, you've got some other great organizations involved. How do we bring the pack up, and how do you translate this out of those large institutions to small organizations, the rush doctor who's going through the fee-for-service treadmill? I mean, how do we get this to break out?
That is a great question, because it's really hard when you're inside the organization. We are so slow to move and adopt innovation in healthcare. We are like lemmings to the sea. But we're fortunate to have members in our network like Intermountain Health, like Ascension Health, like Stanford. And I think the most important thing we do is we create a community of us renegades or mavericks who are trying to disrupt the status quo and support each other. Because as an innovator, it's difficult to be in the trenches disrupting care. Often you have a half-life of about 24 months if you are an entrepreneurial spirit. So the most important thing we've done through the network is create a community so that we can share experiences. And we're not just sharing best practices, we're co-creating, and we're trying and we're failing fast. And then when we find things that work, we rapidly share it. So actually it was sort of selfish that we put this network together. One, I had no peers and no affinity group when I was doing this work 20 years ago. I have more arrows in my backside than most people, as do most people leading innovation in healthcare. We tend to eat up and spit out our young who disrupt the status quo. So I think the way to get this moving faster are have people in your organizations that serve as a bridge to other innovators, and then we bring those in from outside industry to help us disrupt the things we've always done. For example, I'm a huge fan and advisor to Volano Vascular, which is one doctor in the middle of the night on call kept sticking this patient out of her arm to draw blood, and she looked at him and said, I have an IV in the other arm. Why aren't you drawing blood out of that? Why are you tormenting me? And so with the doctor listening to the patient, they came up with an innovation to do just that. So I think it's going to take this collaboration where doctors and patients and nurses are equal partners in driving the innovation.
So you're doing lots of great work on the edge of experimentation. Obviously, you've got a connection here with Vocera. There are other companies working on sort of fixing this communication problem. If I'm somebody watching this and I'm interested in figuring out how more about this patient experience piece, I don't really know much about it, how do I get started? How do I get involved? How do I start understanding the kind of work that you're doing?
Absolutely. Well, I think you can go to vocera.com, our website. You can, under my name, you can Google my name, drbridgetduffy.com. We have a site around the Experience Innovation Network where you can go to that on our website and learn more information, and then happy for you to just call us, and I'd love to chat.
And have you got examples of people who've sort of come into this and maybe not part of the overall, the group of 50, but are able to take this back to their own organizations?
Our group has a bias to action. Our goal is anything that we do is that you can adopt it on Monday. And then each of the members, the criteria is they have to host hackathons or design sessions at their institution. So they host and we go around and share that. The head of the naval hospitals for the country is in the group. He leaves with 10 innovations and he goes back on Monday and his team adopts them. And then we share the successes and then we rapidly stop things that aren't working. So it's rapid adoption testing of innovations.
That's fantastic. Well, real pleasure to speak with one of the leaders in patient experience and patient innovation in the nation, Dr. Bridget Duffy. Bridget, thanks for your time. Great talking with you.